Hi lovelies, it's your girl Princess Bella. In today's video, I want to show you what is in my hospital bag for the mama. Your girl is going to be a mama. I cannot believe I called myself that ugly thing. Please, I'm not. I mean, I'm going to be a mommy, right? But I'm also a real life princess too. Like, I hope I'm not losing my princessly vibes because I'm giving birth. I'm going to show you what is in my hospital bag. You guys don't mind me, please. So these things are some of the hospital requirements and few things that are not exactly hospital requirements that I genuinely feel I need. So you guys, the very first thing I have here is my routine drug. I've actually had not this is not the first routine drug I'm taking. I've taken a syrup that contains exactly the same ingredients here. I've taken pregnant care plus that has more ingredients but it doesn't have enough iron requirements. I'm talking as a pharmacist. I've taken um up to like when I went to the teaching hospital Enugu. They prescribed a lot of drugs for me, like up to 8 to 10 tablets of drugs. I know that me, I'm not the person that is going to be taking up to 8 to 10 tablets of drugs on daily basis. I know that doing that, compliance with that would be hard for me. But the first thing you should know about taking care of yourself, apart from the foods you eat and the exercises you do, is to replenish the your cells that are being used to create a new human being inside of you. You definitely need your routine drug, like even after you finish giving birth, even after you finish getting delivered of, like you still need to be taking them for maybe 2 to 3 months. In fact, I browsed one day that women of reproductive age should be taking folic acid tablets like from time to time. I wasn't taking folic acid tablets, but this particular Ferrobin Plus contains the most important things that are needed for a pregnant woman. Like, I'm not exactly prescribing Ferrobin Plus for anybody though, but I love Ferrobin Plus. It's a capsule. It doesn't have any taste. I enjoy the syrup, but this one, like, if you want to travel, if you want to go to school, it's not big. The volume is not big, and it's still giving you the same thing. And it has high iron content. It has high vitamin B content. It has enough folic acid content, 5 milligram, which is the daily requirement of a pregnant woman. So that is precisely why I like it. It's not bitter. It's not hard to carry around, and it has like the specifications, the basic things I need as a pregnant woman. So I'm not going to stop using it. Second thing is the toll. I don't know, the hospital I'm giving birth in precisely asked for the toll. Otherwise, there are other antiseptics too that are good. I have these two wrappers. The hospital actually asked for 4 wrappers, and myself and my mom are wondering what they want to use the 4 wrappers for. And I figured out that perhaps it's for the process of the delivery, to probably use and absorb some of the fluid that is going to come out of the of the person's body. And then I would ask who is going to wash the wrapper after all. So I just had to advise myself, and I had to buy this delivery pack. This is a waterproof use and throw away something. It's not exactly very expensive. I think I got one of it for about 800 naira. But it's just like it's just like the inside feels like it's white in color and feels very soft like cotton that can actually absorb some water and all. And then the back is this waterproof something that if you lie on it, it's going to absorb water and your amniotic fluid and every other fluid that is flowing from your body during delivery process. You won't have to wash it and continue to use it. You would just probably maybe wash it and throw it away, or just throw it away like that. I'm not sure yet, but I don't have any intentions of using my wrapper for the delivery process. So I just had to buy this delivery pack. So this is an alternative to my wrapper. I had to buy these ones, and then I still had to get these wrappers for my delivery. Tissue papers. This is 2 packets of 6 washable pads. I've actually stayed close to a lot of people that gave birth and are still lactating their babies. And sometimes I understand You know that every fluid coming out of your body has a distinct smell, including the breast milk. So I've seen more lactating mothers, and sometimes I stay close to them and I perceive something that is probably coming out from their breast. I definitely don't appreciate the smell of that thing at all. I feel like it would be in my best interest to get something that is going to be, absorbing the excess milk that is going to be flowing, if at all it's going to happen to me, instead of staying close to people and be discomforting them. So I have with me here 4 packets of lady sets. I don't see any difference between conflict and lady sets. And then I also have this panty liner, just in case. I don't know. The next thing on my list is jig. You guys, there's just a lot of antiseptic, but the hospital specifically asked for jig. I don't even know whether it's for personal use or whether it's for hospital use or whether I'm going to leave it in the hospital while going. But I didn't ask questions. I just had to, you know, buy the hospital requirements jig while anticipating for my new baby. The remaining things, you guys, are nothing fun. I have 3 nursing bras here, which I'm not very sure I want to come and be showing on camera. I have this sleepwear and this sleepwear. They're both 90s, which I don't think is fun enough to come and show on camera. I have this stay-at-home clothes and this clothes and this dress I intend to travel back with. So if I'm in the hospital, I could wear this, and I feel like one is going to be enough. I could get another one just before I leave, and then this one is also my. I mean, I except I'm going to be living in the hospital. I feel like 2 or 3 clothes, dresses is simply enough for me. I don't want to come and be packing unnecessary things. Then this particular small bag is where I keep my toothbrush, toothpaste, soap, lotion, and all those small small things that I feel like I might be needing for 2 or 3 days. But then I just find a way to pack it into this small bag. And that's it, my lovely friend. That is what I precisely have in my little bag for the hospital. I definitely don't intend to stay more than 48 hours in the hospital. Maximum, really. Maximum. Maximum, right? Alright, you guys should please wish me a safe, painless, and a happy delivery. Alright, I'll see you in my next video. Bye bye.